My name is Rick Wilk, and I will be facilitating our webinar along with Amy Vreeland today. And just so you know, this meeting will be recorded. I want to welcome everyone and thank each one of you for participating in the Care Coordination Learning Network. This learning opportunity is brought to you by the Pathways Community Hub Institute, which will also be called PCHI today, as well as the Georgia Health Policy Center. Before we jump into our action-packed agenda, I want to let you know that we've added something for the hubs today following this one-hour webinar. After we complete the agenda for our regularly scheduled meeting, we're going to be inviting any hubs that have time to stay on for an extra half hour for an informal and open discussion. This is in response to feedback we've received from a number of hubs. This part of the agenda is completely optional, so of course you're welcome to sign off after the hour. Okay, great, let's jump in. Amy, what do we have on the agenda today?
You're muted, Amy.
Still can't hear
I'm
you.
unmuted, right? Sorry about that. Thank you. We do have a super packed agenda. Updates on the inspiring work from lots of our hubs. 4 hubs that just achieved certification will be sharing their stories and updates regarding their work and COVID response work that they have underway. We'll also have brief updates from PCHI and Georgia Health Policy Center.
Great, thanks, Amy. As you and the other speakers know, my role is to keep things on track, which some people think I take a little too seriously. For speakers, if you hear the bell, this means you have 1 minute to finish up. We'll work to stay on track to make sure all speakers have time to share and for your questions. Well, to help us get off to the right start, Dr. Karen Minyard, the director of the Georgia Health Policy Center, will share a few words. Karen?
Hello, everybody. I've had a role of sharing inspiration with this group, and I thought I would continue that. And I found this little piece that talked about the impact of the pandemic on our society. The coronavirus will reshape society in lasting ways. These changes will be seen in how we work, travel, receive care, and engage with other humans. For many, this has been and will be one of the most devastating events faced during their adult lives. At this point, it's hard to conceptualize how society will recover and return to normal with now hundreds of thousands of lives lost globally. But we are hopeful. Society has not backed away. Instead, we have demonstrated our capacity and willingness to adapt and leverage our ingenuity in more sophisticated ways. The pandemic has also revived and affirmed our appreciation for human interaction and our inspiration in communities. One of the things that happened when I was looking for something to say and saw this paragraph was I saw a lot of different kinds of awards that are emerging, inspiration awards, innovation awards, and it made me think that everybody in this group should get an award, but maybe something that might come out of our future work is the pandemic award for this group. So that's something to think about.
Good afternoon, everyone. It gives me great pleasure to announce the list of hubs that successfully completed the certification review this past November. PCHI commends each and every one of you on your certification accomplishments and applaud your dedication and commitment to addressing the care coordination needs in your respective communities. Now I'd like to go ahead and move forward and identify each of the hubs. Better Health Partnership Pathways Hub of Chagrin Falls, Ohio. Special acknowledgements to Rita Horowitz and Jonathan Lever for achieving a level 1 designation. Cascades Pacific Action Agency's Community Careport of Olympia, Washington, to Michael O'Neill, special acknowledgements for achieving a level 1 designation. Grow Healthy Together Hub of Bexar County in San Antonio, Texas, to Elizabeth Lutz and Anel Trevino, special acknowledgements for achieving a level 1 designation. Northern Michigan Community Connection of, please pardon me if I don't say this correctly, Charlevoix, Michigan, to Jennifer Murray and Amy Decker, special acknowledgements for achieving a level 1 designation. And I apologize, special acknowledgements for achieving a provisional designation. And last but not least, special acknowledgements to one of our existing hubs, Healthcare Access Now of Cincinnati, Ohio, Sarah Mills and Demita Wright. Special acknowledgements for achieving recertification at a level 1 designation. PCHI welcomes each of you to our National Pathways Community Care Coordination Network. And we know that you will make significant contributions. We are pleased to have representation of 4 states during the certification cycle in Ohio, Texas, Michigan, and Washington State. Once again, congratulations to each of you. We have our pilot Pathways Agency certification program that is going to be launched in January. This is a reminder that the applications are due January 11th. The duration of the pilot will be for 2 years. It will run from January 2021 through May of 2023. The designation levels for the pilot certification program are levels 1 and levels 2. We see a lot of benefits, but we highlight here on the slide that this certification embraces evidence-based approaches. It addresses individually modifiable risks, helps to maintain accountability, and establishes value-based payments.
Great. Thank you, Brenda. It's exciting to see the progress being made in certifying new hubs. And also thank you, Karen, for your inspirational words. Next, Amy's going to walk us through updates from our 4 newest certified hubs. Amy?
I'm breaking the unmute rule, sorry. So thanks, Rick. So each of the 4 newly certified hubs will take about 5 minutes to share about their work. After all of them go, we'll have about 5 minutes for questions about any of them. So if we can ask that you hold your questions until each of them have gone. Healthcare Access Now was also recertified, as Brenda just noted. Many of you already know their wonderful work and the timing of their work, so we've asked just the new hubs to provide updates. I think you'll be interested in the breadth of health and social challenges that the hubs are working to address. So first up, we have Olivia Reed from Olympia, Washington Community Careport Hub. Olivia, you're up.
Good morning, or good afternoon if you're not on the West Coast. Like Amy said, I work with Community Careport, our Pathways Hub. We're located in southwestern Washington. We cover 7 counties that we have about 650,000 people in all our counties combined. It's very rural. The largest city in our region has about 50,000 people, and driving between all of our CCAs takes about 5.5 hours. So my work whenever we are driving around is very busy. And if we go next slide. So our hub has 10 CCAs, about 50 care coordinators, and about 1,600 clients annually. We focus on clients with behavioral health concerns, with a co-occurring concern, or a co-occurring chronic condition or pregnancy. And we really focus on solving basic needs and barriers because about 60% of our clients are unhoused or have unstable housing, and many report food insecurity or other basic need concerns. We are super proud of our recent certification and our first 2 years of implementation. We started in November of 2018. We have really incredible care coordinators and supervisors, and most of our care coordinators have shared lived experience with the clients. So many have experienced homelessness or addiction or incarceration, and it really fits well with our client-centered care model because, you know, we're not these people coming in and telling you what we think you should do. We're walking alongside of you. We've been there. We just want to help where we can. Everyone's super creative. It's kind of needed when you live in a rural area for things like transportation. And just meeting clients in person has been a real challenge recently because of COVID. But since many of our clients do not currently have a home or internet or a cell phone, people have gotten very creative about how to make that happen. And we have a great partnership with our CCAs. We have pretty open and honest feedback on both sides. And I'll show that a little bit in the quarterly review process if I have time. These are just a few of our completed outcomes. So our social service and then medical home and referral pathways are our highest used because of our client population. Our housing numbers have been encouraging, especially for our area, because we have an interesting problem of having enough money and not having enough houses. So it's hard to find an actual physical living space. But our housing numbers have been great due to some extreme dedication from our care coordinators. Alternately, our behavioral health pathways are pretty low considering all of our clients have a behavioral health concern, but we just don't have enough behavioral health providers in the area. And that's one of the reasons I am thankful for Pathways, because we can really easily identify that this is an issue. And then I also wanted to note that our pregnancy numbers are very low because that's just not what we focus on. And then we have our patient activation measure and our PHQ-9 depression screening. The two screening tools we primarily use, both have shown an improved score over time, which we are really excited about. We have two new programs, our hunger response vouchers, which are $10 for fruits and vegetables at a local grocery chain. And we pair these with education pathways and healthy changes goals. This has put about $50,000 into our community so far and has been really successful in getting client engagement. And we also have our COVID care program, which started at the beginning of COVID within our existing framework to try to keep people isolated. And now we're expanding to join the Washington Department of Health program. And so that's going to expand the service quite a bit. And this is our quarterly review process. So the first time we sent out a quarterly review, any sort of information to our agencies, we just sent raw data, and that was really not our best move. 1 minute, okay, cool. It was not our best move because I think whenever you just send raw data, it's really easy to scan over all the good things and focus on those negative numbers. And so this is our new process. We've been doing it, I think, for about a year now, and it's been a lot more successful. I had cut off the top and the bottom here to make it fit, but the first section is just overall hub data. When one of our agencies succeed, we all succeed, so we want to showcase that we're all doing this together. The second is just agency standing, whether we need to have a meeting with them or a phone call. And then the bottom is my favorite part. It's our agency specific data, and it really gives us the opportunity to highlight the excellent things that the agency is doing, and just show that, you know, really highlight the things that we're proud of, and, you know, give them some feedback on things that they can improve on, but show that it's a partnership where we can really work together to make everything the best it can be for our clients. So thanks for having me. We are really, really excited to be a certified hub.
Thanks so much, Olivia. Your housing numbers are remarkable. That you and your teams have gotten that many people securely housed is incredibly impressive. And the way that you collaborate with your agencies is really, I think, very admirable and productive, and nice work.
Thank you.
And next up is Jennifer Murray from Charlevoix, Michigan, from Northern Michigan Community Connections.
Okay, thank you. Next slide, please. Hi, so I'm Jennifer Murray. I'm the Hub Director for our Northern Michigan Community Connections Hub. We're also very excited to be certified. And this is a map of the lower peninsula of Michigan, and you can see highlighted in color are the current 21 counties in which we're providing services. We have a goal to have our services in 31 counties, adding those additional 10 counties that are in gray. We have 4 CCAs in our current 21 counties, and we serve any child or adult with a social determinant of health need. Next slide, please. Our program's called Community Connections, and it's part of a 3-pronged approach to improving health in our communities. Our Community Connection program, like yours, focuses on the individual and meeting their SDOH needs. The Community Health Assessment focuses on both the individual sectors in our community, like the food sector, the housing sector, the utility sector. And our improvement plan really focuses on systems change across all levels, both individual and community. Our hub receives referrals from over 36 patient-centered medical homes across our region and over 20 plus community-based organizations. These sites do SDOH screening to assess the needs of individuals and families. And once clients are screened and they want to have our navigation services, then they're referred to our hub. We also receive self-referrals and other referrals in which there wasn't a complete SDOH assessment. We serve about 1,200 people per year. Go ahead, next slide. So I thought I'd focus on COVID-19 because we were so thankful that we had our Community Connections program up and running when the pandemic hit, because without it, we just wouldn't have been able to really spring into action and meet the needs of families that were emerging at a really fast rate. So what we did is we wanted to publicize Community Connections. We sent out flyers through all our schools in those 21 counties. They went out with home delivered meals, emails distributed by counselors. We also were able to share a flyer with our Commission on Aging partners across, actually it was 21 counties. And also through a human service group that we have. We really wanted to just make sure all organizations and agencies knew how to make referrals to Community Connections. We also, because our CCAs are housed in local health departments, our health officers had weekly conversations with a variety of people and always included Community Connections referral information in those community conversations. We also held monthly calls with our patient-centered medical homes to make sure that they were still offering services. They weren't seeing patients face-to-face, and that was a real barrier. And I'm going to talk about that a little bit later here. But we wanted to maintain our Community Connections visibility with our patient-centered medical homes. We also offered Community Connection referrals to anybody who was in COVID quarantine or isolation, recognizing that most likely they were going to need access to some resources. Next slide, please. Other ways that we scaled up our Community Connection services was we really wanted to nurture partnerships. Our area agency on aging were really overwhelmed with some of the Worried Well senior calls. And so we would conduct senior mental health calls on their behalf and facilitate CC referrals when that was needed. We assisted with, dropping food off on porches for our aging partners. We partnered with our Migrant Farm Worker Council, recognizing that spring and summer we were going to have an influx of farm workers. We wanted to make sure that our education pathways regarding COVID-19 were implemented and that migrant farm workers knew where to go for resources or testing, treatment. And we were able to provide those with our bilingual CHWs. We also utilized the Basecamp site, which is a platform to communicate across agencies. We were able to solve multiple community problems in a real timely manner. We helped families be able to use their EBT card out in the parking lots of stores versus having to take their whole family into a grocery store. That was a real problem. Families weren't able to access their benefits because they were afraid to go into stores. We were able to make sure that our food pantries had extra formula and diapers available. Those are high ticket items. And we wanted across the region to make sure all of our food pantries had those supplies. A lot of our baby pantries were closed down. We wanted to strengthen 211 use. So people that just needed a phone number, and that was it, we wanted to make sure that our 211 was accessible. And then we were able to use that Basecamp site to problem solve other issues. Next slide, please. Oops, back one, please. There we go. This particular table shows our CC referral and pathway changes. So the first column there is January through March before the pandemic hit. And then I put in April through June when we were in the midst of the pandemic. You can see that we had a real increase in referrals from our community agency partners, just internal within our CCA, identifying additional individuals needing help, and an increase in our self-referrals that clients made. We had a big decrease in our physician office, dental office, hospital partners because they weren't seeing people face to face. So it's just interesting to see how we just had this shift from where our referrals were coming from when the pandemic hit, keeping our referral numbers about the same in those 2 quarters. And then, yeah, back a little, there we go. I wanted to share with you just the increases in our pathways. Even though our referral numbers stayed about the same, most individuals had more pathway needs. Our food assistance went up over 100% increase, 167% increase. Health insurance went up by 24% with the beginning of people losing their jobs. Utilities assistance increased as well as financial assistance. So as I mentioned, our number of pathways increased per person. And even though the amount of referrals basically stayed the same. Next slide, please. Another important component, and you can just keep clicking because this slide will add pictures. Just keep going. There you go. We do a really good job of sharing our de-identified client data with our community health needs assessment process. And so on a quarterly basis, we share what pathways we're able to complete, which ones are incomplete, and why they might be incomplete with our action teams. This really helps them drive strategies that are relevant and real time. For instance, our community action teams were busy planning additional bus routes for a transportation work group. Their strategy was to add bus routes, but what was really needed, what we found out from our clients, was car repair. Sharing that real-time data with these action teams allowed them to change their strategies and really target the strategies to what the real-time needs were for families. So it's really important for us to be able to share that data quarterly with our action teams that are creating strategies. So we see that as a really unique and successful part of our hub.
Jennifer, I'm sorry, the bell wasn't going, but I need to move on.
I'm done. Thank you.
Beautiful work, and what great examples of how you're using data to inform the community about the work they need to be doing. So thank you for sharing that. Next, we'll move to our first certified hub in the state of Texas, Grow Healthy Together San Antonio. Anel Trevino from Bexar County. You're up, Anel.
Thank you. So my name is Anel Trevino. I'm the Learning and Collaborations Manager at the Health Collaborative. If we can go to the next slide, we're in San Antonio, Texas. And so our hub began in 2018. And the Health Collaborative has been around for about 20 years. But we decided, or the pilot, the launch of our hub was in 2018. And so we launched with 20 CHWs. And we currently have 16 CHWs and 8 CCAs. And as of November 2020, we are certified. We have different partners or CCAs with different expertise in our hub that you know, are more focused, whether it's in housing like WOC or you know, with food resources. We have faith-based organizations such as Redeeming Grace or Hope International, and we also partner with larger organizations, clinics, and hospital networks, as well as community-based organizations. Next slide, please. And so through COVID, we've done different things We've taken on, we haven't seen a huge increase in our clients, but what we did see was a huge increase in food. So one of the things that we did was we went out and began a food distribution within our hub and within the health collaborative. So we supported all of our CCAs and all of our partners within our organization. And so we partnered up with several counties. We had to reach all the way out to Maverick County. So we worked with Atascosa, Maverick, Bexar, Medina, and Comal County to provide food to over 16,000 people, 16,000 individuals. And while we did that, we were trying to reach out and share and put the word out about the hub and the different resources, the different types of help that we're able to provide and bring to each one of those families. Another one of the things that came about during the COVID pandemic, and as we grow and things evolve in our community through the pandemic, was the need for resources. Several of our partners and CCAs saw a reduction in services as well as labor and force. So while they had to reduce their number of employees, the need was going up, right? So what we did was we started a program.
And
so
now,
we have 8 new community health. Yes.
You might turn your video off. I think that you're having some internet speed issues and we're having some trouble hearing you. So if you turn your video off, great.
Got you. Okay.
Thank you.
Perfect. So, okay, awesome. Hopefully that'll help a little bit. So yeah, so with the different issues that our community is having with COVID and increased needs, we began a training cohort, and so we were able to certify 8 new CHWs or community health workers in the Bexar County area. And so that also helps with educating and slowing down, hopefully, of COVID in our community. These individuals were trained in telehealth, contact tracing, which are huge needs and impact in the pandemic as it evolves. So they were also trained and certified to become CAC, Certified Assistance Counselors for CMS, as the open enrollment for the Affordable Care Act period began. They received certification and training for health literacy, HIPAA, mental health, all of these topics, not only supporting the core competencies for community health workers, but also important topics during the pandemic and as individuals and families are home and facing different needs. If we can go on to the next slide. So while we do not focus or target a specific population, we do have some programs that do bring in, a high number of referrals, such as a partnership program with United Way that focuses on prenatal education. And so that has grown also our population with grandparents raising grandchildren, which ties in directly with CPS and Child Protective Services, right? We see different types of families raising children. And so this has, really changed the dynamic of the families that we're serving and the populations that we serve. While we focus in Bexar County, these different families are coming in from various areas. And given the geographic nature of Bexar County, we're finding that we're serving, families from mainly San Antonio and Bexar County, but they're bordering the Atascosa, Comal, and Medina counties. So really, again, although we do not target a specific population, we're seeing, higher groups in certain areas, but we're receiving referrals from different populations and different geographic locations. And I think that's our last slide.
And now that was great. Thank you. 16,000, feeding 16,000 people is incredibly impressive, and the breadth of families you support is wonderful. So thank you for sharing. Next, our last hub that will speak today is Better Health Partnership. And Jonathan Lever, the program manager, will be sharing an update on their hub. You're up, Jonathan.
Thanks, Amy. You can go to the next slide. So Better Health Partnership is a regional health improvement collaborative founded in 2007. We serve Northeast Ohio region. And in 2020, we made the decision to add to our existing work, which involves primarily bringing different sectors together: healthcare, social service, education, together to share best practices and advance data-informed improvements in equitable population and community health. Traditionally, we've focused on data collection of EHR data and sharing of best practices for adults with chronic disease and pediatrics with asthma and overweight or obesity. And like I mentioned, in 2019, we made the decision to move to becoming a Pathways hub for Cuyahoga County. Next slide. So the Better Health Pathways hub serves all of Cuyahoga County. So we're that area in red there, just off of Lake Erie. We began operations at the very end of February, right before the pandemic hit. And I'd like to give a good shout out and thank you to our hub mentor from Summit County, just kind of a little bit south of us. So Amy Budnick, Dennis Kimmery, and Sarah Hanlon and their team. So we're fortunate to be paired with a mentor hub in Ohio to help us through a lot of learning the ropes. So thank you to you guys. In 2020, we've ramped up. We now currently have a total of 10 contracted agencies, 22 community health workers, 12 supervisors, and over 220 clients enrolled in just under a year. Obviously, we've been impacted by the pandemic as well. Next slide. These are a list of our care coordination agencies. So we have a mix of grassroots community-based organizations, as well as health systems, other nonprofits, all of it that often have a specific area of focus. Some focus more on pregnancy, others focus on homeless adults, some focus on kids. So really excited that we have agencies that will cover the basis of the lifespan from birth all the way through elderly folks. Next slide. So as I mentioned, our focus is on adults, children, and infants. And the next section will go over some of our strategic projects that we have focused on those specific patient populations. Next slide. So in the area of infants and pregnant women, we partner with First Care Cleveland, which is a county public-private partnership to reduce infant mortality. It's a big multi-group collaborative. So we are heavily focused on premature births, reducing prematurity, reducing infant mortality. In particular, we're also particularly focused on the disparity. There's a significant disparity between Black babies and white babies and other minorities. So we're heavily focused on improving that in our county through the hub. Next slide. In terms of children, we've partnered with Invest in Children, which is the Cuyahoga County-based entity, as well as the health systems and our Lead Safe Cleveland, to increase lead testing and referral rates. So lead is a huge issue in our community, going back to the history of redlining and other inequities. And so we are kind of in this project partnering with the health systems, using our traditional data collection efforts as well as the hub to leverage community health workers to help complete the lead pathway and get more folks and kids tested and connected to resources. There was a report from Case Western Reserve that showed in recent years about half of all kids that are supposed to be tested on Medicaid are having a lead test completed. So we've collected already some of that neighborhood level data and are in the current processes of training the community health workers specifically around lead to deploy and increase the lead testing and referral rates, and ultimately to reduce the harmful effects of lead in our community on development and show a return on investment for that work. Next slide. And finally, around the area of adults, we're partnering with the Cleveland Clinic Foundation to help homeless individuals that are either in their ED or in their behavioral psychiatric unit to help try to get home, trying to get home, becoming less homeless and getting them also the other additional care and resources that they need. You can see from the graph over there on the right, a significant number of their homeless population seeks care in the ED. And so one of our agencies, Carmela Rose Health Foundation, specializes in homeless population and is working diligently to connect those individuals to better housing in the community. Next slide. And finally, one of the areas that we've focused on with our hub is our data analytics, leveraging Tableau as a way to create data visualizations. So this is just an example of some of the data visualizations that we've been able to create using Tableau and some of the ways that kind of rapidly we can filter data, identify data, and share it with our partners as well as our agencies and community health workers. We in the future are planning to do link our hub data with other data sources in our community for leveraging for advocacy, improvement, and payment change. So we're interested in leveraging and connecting that data with the individual PHI data that we have on adults and children, as well as other educational data and other entities that we can to try to better coordinate care by integrating with others.
Jonathan, thank you. That's great. Your data-informed approach is really interesting. The visualization is really powerful. So thanks for sharing all of that.
Thank you.
Thank you. So we've got about 5 minutes now to allow the audience to ask questions. So you can do one of two things if you have a question. Looking at the screen, you can see how to raise your hand in Zoom, or if you go into the participants area and just raise your hand, you can do that and we'll unmute you and let you ask questions. And it's looking like we might not have any questions, except a wonderful message from Sarah to Jonathan. Great job and really hard work this past year. We've been honored to be your mentor. It's nice to see the hubs working together. Any questions? Michelle, we have a question here. I'm going to unmute you. There you go.
Hi, good afternoon. I just want to congratulate all the newly certified hubs. Welcome aboard. And if any of the other hubs, especially the ones, I'm with the Mahoning Valley Pathways Hub in Northeast Ohio, so just down the road from Jonathan. And so I'm just curious as to how some of the other hubs are funded, if any of the new hubs want to speak to that.
Sure. This is Jennifer Murray from Northern Michigan. And we have secured 4 different Medicaid health plan value, or 2 of them are value-based reimbursement contracts, and 2 of them are per member per month. And we are also funded by having our CCAs housed in local public health. We are able to leverage a 50% Medicaid outreach match. So partnering with your local health departments around Medicaid outreach is a really great way, because all of this pathway navigation work falls under Medicaid outreach if you're outreaching to Medicaid clients. I shouldn't say Medicaid clients, clients with Medicaid insurance. And so that's a possibility to learn about with your local health department partners about how to be able to, because we really couldn't survive. We know we couldn't survive without that Medicaid outreach match at 50%. So something to consider if you've got local public health at the table.
Thanks, Jennifer. Olivia, you're up too. You had some thoughts too.
Yeah, so we're kind of a unique situation. Washington has a Medicaid transformation thing going on right now for 5 years. So we're going towards the end of that. So our program has been completely funded through the Medicaid transformation project so far. We are currently looking for additional funding. We are really excited about like the COVID care program that I mentioned, and some other partnerships with the state potentially have additional funding. Which originally was not the case because our state also has health homes, which the state views as a very similar program. I do not for some various reasons, but it has been really promising to see that we had been kind of overlooked by the state, but we have some solid enough data to make them kind of reconsider that and think about the value we're adding to the community. So our funding has been a little different than most, but I'm excited that our data has actually encouraged others to help us continue this work.
Thanks, Olivia. Lauren, you are unmuted as well, and I think that's our last one that we can fit in, but Lauren, we'd love to hear from you as well. I think you're unmuted.
Can you hear me?
Yes.
Okay. Hi, everybody. Hi to all my friends I haven't seen in a long time. So in New Mexico, we were funded to actually create a value-based billing system. And then we got a new governor. It seems to always work that way. And so the new governor has moved back to fee-for-service because of a budget shortfall. She really wants, instead of using grant funding, she wants us to bill Medicaid prior to grants. And in New Mexico, no county bills Medicaid. We're the first one to do it because the state rules make it very difficult. So we actually had to change state policy to bill Medicaid. We're providing case management and jail diversion for substance abuse. And so the Medicaid billing model for what looks like case management, care, CCSS, Community Care Coordination Services, does not work for our heavily justice-involved clients. They can't make appointments. They can't really defer defer rewards for 30 seconds, let alone a few days. So what we're doing is we're changing our whole model so that we're going to be trying to operate a virtual and in-person drop-in center. In-person later after we're done with COVID, right now virtual. And we're going to be looking at doing groups instead of individual counseling. We're mainly focusing on dialectical behavioral therapy because it is very immediate and it helps our clients to eliminate triggers and develop just skills to get through their day. And we already do a lot of the care coordination. There are some things that we're doing that are not covered through Medicaid. We haven't figured out how to resolve that yet. The most important is transport to services, and it's a big part of our success. And some of the others have to do with advocacy for our clients. So we're still working on that. I'd really like to team up with you and reach out to the state to see if we can't get them to look at value-based Medicaid billing. I think they'd be open to it. And so I'm pretty excited about the new model that we're establishing. We're also trying to tie rewards to completion of a DBT course or a DBT class, or basically to something that we need them to do in order for us to bill, but is also good for them that they're less interested in. So we're really using operant conditioning. And what we're trying to do is, because they have been in the justice system in and out for years, they're used to being punished all the time. So what we're trying to do is to build motivation and the desire to do something different through positive rewards instead of through threats.
Lauren, that's wonderful. Thank you for jumping in and sharing that. For time reasons, I'm going to ask that we move on, but you do wonderful work. Thank you. Mark, do you want to progress? Great, thank you. There's just a couple other things that we're involved with at PCHI. We're very interested and committed to making sure we're hearing from the hubs and what's going on. So there's a number of ways in which we're working to collaborate with the hubs. Two specific ones is that we've got a couple groups going where we're piloting some of the PCH model enhancements, the learning modules and the quality benchmark report. I'll just move through that one quickly. We'll give you updates as we get more. They're both somewhat nascent and getting off the ground, but we just want to make sure that as we introduce new concepts and new elements or enhance the existing elements of the model, that we're getting real good feedback from you and your CHWs who are actually using the tools to make sure that we don't miss the mark. Another hub collaboration is a piece of research that's underway with the, based on funding from Georgia Health Policy Center and Robert Wood Johnson. That is being led by Kent State and John Hornbeek, who many of you know. And the research piece there is identifying how hubs are facilitating or not communities aligning around financing and data use and vision and such. So there will be a few case studies coming out of that, and there will be a chapter being developed on that that we'll share as we understand more about that in time. So as more opportunities for collaboration come up, we'll share that with hubs, and we're always so eager to hear what you're doing and to get you participating in any of those. And then to Rick, an event update.
Thanks, Amy. Gosh, it's great to hear this progress. And I just want to say we appreciate the work each of you are doing so much. It's extraordinary. These presentations just have to be expanded and further highlighted at a future in-person events we're planning, and ideally as soon as possible. So we're looking forward to the CGA conference tentatively in the fall of 2021. And also we at PCHI are planning a national workshop in Columbus, hopefully in person, if we can do that, in June 2022. So again, if you put in your calendar fall 2021 for CGA conference and June 2022 for the PCHI National Workshop. And then last thing I want to share is PCHI will be hosting the next quarterly CCLN meetings on March 1 and June 1 at 1 p.m. Eastern time. So if you could put that on your calendar as a placeholder, March 1 and June 1 at 1 p.m. Eastern time for our next CCLN meetings. Great, so next in the lineup, we have Sarah Redding, the director of the Pathways Community Hub Institute. Sarah?
Hey, Rick, thank you. I too would like to congratulate all the new hubs and like to point out that we have now 17 certified hubs and several more in the works, so that's really exciting. I will just be really brief here. We have a lot of updates to the model coming next year, and we have purchased the Blackboard Learning Management Platform as a way to hopefully get information out to you in a timely manner. So those, if you are a hub director or if you are in the process of going through certification, you should have received an invitation from me to join Blackboard. If you've not, I've got my email there in bright blue. Please reach out to me and I will make sure that you're added. Also, if you have any additional hub staff that you would like added to the trainings, please let me know. We've got 2 trainings scheduled in December. The first one is December 10th, and that will just be focusing on the prerequisites. And then on December 17th, the standards. Now, if you're not a certified hub, but you're interested in these trainings, just again, email me and I'll get you an invite to that. And that's all I have. Thanks, Rick.
Thank you, Sarah. Next up, we have our colleague at the Georgia Health Policy Center and co-coordinator of the CCLN, Bill Renscher. Bill?
Next slide, Rick. Thank you. Good afternoon, everybody. I just wanted to give you a quick update about some things going on at GHPC. All this year, we have been compiling resources, creating and compiling resources on the related to the COVID-19 pandemic. Those can be found on our website at our resource page. The link is there for you. Most recently, we reviewed the CARES Act. We took quite a bit of time to do this, reviewed it internally, and then created several briefs related to how the CARES Act affected different aspects of public health. And so we have briefs on access to healthcare, childhood health and well-being, food and nutrition policy, long-term services and supports, and rural health. So check those out when you have a chance. And then finally, I just wanted to mention an event that we have going on tomorrow. That's the Health Equity in America webinar with journalist Linda Villarosa and Dr. Leandris Liebert, who is the CDC Associate Director for Minority Health and Health Equity. And you can register at the link there at the bottom. And I assume we'll be providing these slides to everybody after the meeting. So thank you. That's all I have.
Great. Thank you, Bill. I appreciate the important updates and these valuable resources, and also the invitation to the Health Equity in America webinar. Okay, so now we have a time check. We actually have 8 minutes for more questions and comments, which is great. So thank you for everybody for being timely and allowing everyone to have enough time to speak. But Amy, I'm going to turn it back to you. If we have more questions or comments, you're welcome to put those in the chat box or raise your hand. Amy?
I've got my eyes open for other people with questions. I haven't seen anything yet, but I'm looking. I did get a comment from a hub of a potential agency in New Jersey that's interested in applying to be part of the pilot agency certification. So that's exciting. We'll share more about that when that matures. Any other questions? Rick, I think we're moving on.
Okay, great. Thanks, Amy. Well, it looks like our main event time is coming to a close. So I want to thank each of the speakers for taking the time to participate today. And I want to thank each and every participant for your involvement. Staying on for our informal social half hour is completely optional. I know we just added that fairly last minute in response to some feedback we had received. Next time we'll give you more advanced notice so you can plan into your schedule. But this otherwise concludes our event today. So I want to thank you all for joining. If you're staying on, we will be facilitating your open conversation. We have 30 minutes for hubs to talk and play a little. It's a bit of a more relaxed conversation, but this is a space for you to talk about whatever is of interest to you. All microphones will be turned on now for open conversation with one rule. If you talk longer than 3 minutes, you will hear the bell, and I'll ask you to quickly summarize your thoughts so as many people as possible have a chance to share. We're going to stop the recording now, and thank you everyone for participating. If you'd like to stay on, feel free. Jump right in.
Great
Jump right in
input.
if you have any questions. Sorry, Amy.